All right. Now we're going to talk about the 2017 Qcdr, which is a separate sheet from our billing sheet. When it's processed by our billing company, they're handled differently. As far as, think of it as each one of these sheets that's filled out completely and correctly is like a $5 bill. Each sheet that is filled out means $5 for the group. So we would appreciate if you would do your best to fill it out completely. If it's not filled out completely, we have a box in the anesthesia workroom. It will be filed under your name in a file folder with the expectation that you complete them as soon as possible. As far as I'm going to run through here quickly, please remember to circle the type of anesthetic. Even though it might seem redundant and you fill it out on the billing sheet, again, these are processed separately, and so please circle one that applies. Also, this goes for the ASA physical status. Please circle the one that applies. This should also mark or at least match what is in the physical exam on Epic. If it is an emergency, please document that here by circling E. As far as I'm just going to run through the boxes here, I wanted to point out in the case of the first two boxes that these are for non-emergent cases. So if you use the E code up here, or the mark E up here, you will not have to fill out the first two boxes. Otherwise, fill out the respective line if they are non-emergent. For the next box, the corneal injury, notice that you only check if the patient is 18 or older, and check the respective box. Note that this bypass PACU applies that if the patient either goes to the ICU or does not go directly to the PACU, then this is where you would check it. As far as for this next box, with the OR, it means PACU or ICU. Fill out the respective boxes in either. If they go to the PACU, fill out this one. If they go to the ICU, fill out this one. The next two boxes with the OR is for the nausea and vomiting requirement or information. The left side here is for adults, the right side is for peds. If the patient is 18 or older and had an inhalational anesthetic, then you will check if they have 3 or more risk factors. If they do have 3 or more, then you will check one of these. If they have neither a 3 or more risk factors nor an inhalational anesthetic, then you wouldn't check any of these. If the patient has TIVA, you can write TIVA, but basically we are going to assume if you do not mark inhalational anesthetic, then they had some sort of TIVA or IV anesthetic. If they do not have 3 or more risk factors, there is no reason to check any of these, even if you give the drugs. And the same applies for peds over here. If it's a 3 or older to 17 and they're inhalational anesthetic, the only difference will be if they have 2 or greater risks. Next, if it's a general anesthetic, meaning there's some supraglottic device placed, be it either a LMA or an endotracheal tube, you will fill this out. If it is either a regional anesthetic or a MAC and no supraglottic device is used, then you will not fill out this box. As far as for the next one, again, if it's a general anesthetic, which we classify as either an endotracheal tube or some sort of supraglottic airway, please circle either one based on what you used in that case, and then check the next two boxes based on what actually occurred. If you do go to the ICU and you go straight to the ICU, you check the bypass PACU. If you circle the endotracheal tube up here and it was a general anesthetic, then you will check both these boxes. Again, if you go straight to the ICU, you do not have to, you check this box. Otherwise, whether it's one positive pressure breath or a whole case with controlled ventilation, please check this box if it's delivered via endotracheal tube. As far as the next box for the perioperative temperature requirement, the important note is if it's 60 minutes or greater, it's a general anesthetic or neuroaxial, check this one. If it's a MAC, you check this one. If it's a peripheral nerve block, you check this one. However, the only one that has a temperature requirement will be this first box, or first general anesthetic or neuroaxial, and then you would check yes if you met it. Otherwise, you would use these. If it's simply just a MAC or a regional anesthetic, then you do not need to fill out this box. And then finally, if a central line or central venous catheter is placed and it is in a non-emergent case, you will check the respective line. Hopefully this clears up the Qcdr, and thank you for your time.